everyone. Myself, Dr. Fagun Gajjar, working as an assistant professor in Department of Cvts at UN Mehta Institute of Cardiology and Research Center. Our today's topic is anatomy of thorax. We are going to cover this topic under the following headings. First one is the thoracic wall, which includes the skeleton of the thorax, movement of the thoracic wall, muscles of the thoracic wall, nerves of the thoracic wall, and vasculature of the thoracic wall. And the other part is the thoracic cavity, which includes the pleura, lung, mediastinum, and the great vessels. So, introduction. Thorax is the superior part of the trunk between the neck and the abdomen. It contains the heart, great vessels, lung, thymus, trachea, and the esophagus. The organs in this region are constantly moving, hence it is a dynamic region. It provides a protective cage around the vital organs like heart, lung, and great blood vessels. It provides support for the shoulder girdle, provides bony attachment for the muscles of the back, chest, and shoulders, and it helps in breathing to happen. The first one is the thoracic wall. The skeleton of the thorax is formed by the osteocartilaginous thoracic cage, which includes 12 pair of ribs and costal cartilages, 12 thoracic vertebrae and intervertebral disc, and the sternum. The 12 pairs, out of these 12 pairs of ribs, rib 1 to 7 attaches directly to the sternum by separate costal cartilages. Hence, it is called as the true ribs or vertebrosternal ribs. Rib 8 to 10 attaches directly to the sternum by attaching to the costal cartilages immediately above. Hence, it is called the vertebrochondral ribs. And ribs 11 to 12 have no anterior attachments. Hence, it is known as the floating ribs. Out of these 12 pair of ribs, the ribs 3rd to 9th are the typical ones. These are the bowed flat bones with long shaft. It has a head which has two facets to articulate with its vertebra and the one which is above the corresponding vertebra. Tubercle which articulates with the transverse process of the corresponding vertebra. Neck, which is a part between the head and the tubercle. The other part is the shaft or body of the rib, which is flat and curved. The angle of the rib is the point of greatest change in the curvature, and the costal groove is lying on the inferior border and protects the intercostal nerve and the vessels. And the costal cartilages attaches the rib to the sternum. Out of the atypical ribs, the first rib is the broadest and the most curved. It is flat and has a scalene tubercle for the attachment of the scalenus anterior muscle. Many clinically important structures crosses the first rib, out of which the important ones are the subclavian vein and artery and inferior trunk of the brachial plexus. It is difficult to palpate because of the presence of clavicle just above it. Second rib is thinner and less curved. It has a tuberosity for the serratus anterior muscle. This is the first anatomy of the first rib, which is showing the groove for the subclavian vein anterior to the scalene tubercle, and posterior to it lying the groove for the plexus, groove for the subclavian artery and the inferior cord of the brachial plexus. Posterior to it is the attachment of the scalenus medius muscle. The 10th rib articulates with the T10 vertebra only, and the 11th and the 12th rib are the shortest, have single facet on their head and have no neck or tubercle. The sternum is a flat bone which lies in the anterior midline of the thorax. It consists of the three fused bones, the manubrium, the body of the sternum or gladiolus, and the xiphoid process. The manubrium is located at the level of T3, T4 vertebra, wide superiorly and narrow inferiorly. The superior surface is indented by the jugular notch. The clavicular notch articulates with the clavicle. The first rib articulates with the lateral margin, and the inferior border articulates with the body of the sternum and forms a projection which is called sternal angle of Lewis. It lies opposite second costal cartilage, and hence it is a guide to number the ribs. The body of the sternum is located at the level of T5 to T9 vertebra. It has lateral wall has costal notches for the attachment of the ribs. It is marked by the three transverse ridges, which is the line of fusion of the four segments of the body of the sternum. Xiphoid process is a sword-shaped structure which is cartilaginous at birth. It is a landmark for the inferior limit of the thoracic cavity and the inferior border of the heart. Regarding the thoracic vertebra, the total of 12 thoracic vertebrae, the typical ones are the T4 to T8. The body is larger than that in the cervical vertebra. It is a heart-shaped structure. Its spinous process is long and sharp and projects inferiorly. The vertebral foramen is circular and T1 has a long horizontal spinous process. The transverse process projects posteriorly and bear costal facet for the ribs in first to 10 thoracic vertebra. The body bears two costal demifacets in T2 to T9. The superior one articulates with the head of its own rib and the inferior one articulates with the head of the rib inferior to it. T1 has a complete facet superiorly while T2 to T12 has only one facet. Regarding the thoracic apertures, the thoracic inlet is lying superiorly. It is the site of entrance of the viscera and the vessels from the head and neck and upper limbs into the thorax. It is kidney shaped. While thoracic outlet is closed by the diaphragm, pierced by the inferior vena cava, aorta and the esophagus. Regarding the muscles of the thoracic wall, these are divided broadly into two classes. Muscles related to the thoracic wall like pectoralis muscle, muscles of the abdomen and muscles of the back. And the other group is the muscles of the thorax proper, which includes the serratus posterior, levator costorum, intercostal, subcostal and transversus thoracis muscle. These are the muscles of the anterior thorax, which includes the pectoralis major muscle, sternocleidomastoid and the serratus anterior muscle and pectoralis minor. And the muscles of the posterior thorax includes the trapezius muscle, the latissimus dorsi muscle, infraspinatus, supraspinatus and teres minor muscle. The muscles of the thorax proper. First one is the serratus posterior superior. It originates from the ligamentum nuchae and spines of C7 to T3 vertebra. It inserts into the superior border of second to fourth rib. It acts to elevate the superior ribs. The other one is the serratus posterior inferior, which originates from the spines of T12, T11 to L2 vertebra and inserts into the inferior border of inferior 3 or 4 ribs. It acts to depress the inferior ribs. The muscles of the other one is the levator costorum. It is a 12 fan-shaped muscle which originates from the transverse processes of C7 to T11 vertebra and inserts onto the ribs. It acts to elevate the ribs. Regarding the intercostal muscles, it contains the 3 layers of muscle. First one is the external intercostal muscle, second is the internal intercostal muscle, and third one is the innermost intercostal muscle. The external intercostal muscle originates from the inferior border of the rib above and inserts into the superior border of the rib below. It occupies the intercostal spaces from tubercle of the rib to the costochondral junction, and anteriorly beyond the costochondral junction it is replaced by the external intercostal membranes. The action of this muscle is to pulling of the ribs upward to aid in respiration. The muscle fibers project inferiorly in a posterior to anterior direction. The second one is the internal intercostal muscle, which originates from the superior border of the rib below and inserts into the inferior border of the rib above. It occupies the intercostal spaces from sternum to the angle of the ribs. Posteriorly, it is replaced by the internal intercostal membrane. It acts to draw the ribs together, which aids in respiration. The muscle fibers of this muscle projects superiorly in a posterior to anterior direction, which is perpendicular to the fibers of the external intercostal muscle. The innermost intercostal, it is similar to the internal intercostal. Deep portion, it includes deep portions of internal intercostal muscle. It is separated from the internal intercostal by the neurovascular structure like intercostal nerve and vessels. The subcostal muscle is variable in size and shape. It extends from the internal surface of angle of ribs to the internal surface of ribs below crossing one or the two intercostal spaces. The transversus thoracis muscle is the originating from the back of the sternum and the xiphoid process and inserts into the costochondral junction of the rib 3 to 6. It can bridge more than one intercostal space. Now, regarding the respiratory movements, breathing or pulmonary ventilation consists of the two phases. First one is the inspiration, which is the period during which the air flows into the lungs, and second is the expiration, the period when the gases exit the lung. The lung expands during the inspiration and retract during the expiration. These movements are governed by the movements of the thoracic wall to increase the volume of the thoracic cavity and elastic recoil of the lungs and the thoracic wall. The principles of the movement: each rib is considered as a lever with its fulcrum lying lateral to the tubercle. The anterior end of the rib is lower than the posterior, thus when elevated, the anterior end also moves forward, which is known as the pump handle movement. The middle of the body of the rib lies at the lower level than the two ends, thus when elevated, it also moves outwards, hence it is known as the bucket handle movement. This figure represents the pump handle and the bucket handle action. During inspiration, the lungs increase in volume by enlarging in all the dimension. Inspiration lowers the air pressure within the lungs. Air flows from the areas of high pressure to areas of low pressure to equalize the pressure within the lungs to that outside of the lung. During the normal quiet inspiration, the diaphragm and the external intercostal muscle produce the muscle movement. The action of the diaphragm: when the dome-shaped diaphragm contracts, it moves inferiorly and it flattens. As a result, the vertical dimension of the thoracic cavity increases. The action of the intercostal muscle: the external intercostal muscle contracts to raise the ribs because the ribs normally extend antero-inferiorly from the vertebral column. Lifting them enlarges both lateral as well as the anterior dimension of the thorax. This figure represents the action of the external intercostal muscle. When contracts, it elevates the ribs and moves the sternum forward. Hence, it increases both transverse as well as the anteroposterior dimension of the thoracic cavity. During deep inspiration or forced inspiration, additional muscle contract and further increase the thoracic volume. The rib cage is elevated by the scalene and the sternocleidomastoid muscle. The scapula are also elevated and fixed by the trapezius, levator scapulae, rhomboids, so that the serratus anterior and the pectoralis minor act on the ribs. During expiration, as the respiratory muscles relax, the rib cage drops under the force of gravity and the relaxing diaphragm moves superiorly. At the same time, many elastic fibers within the lungs recoil. The result is the volume of the thorax and the lungs decrease simultaneously, which pushes the air from the lungs. During forced expiration, it is an active process produced by the contraction of the muscles in the abdominal wall, primarily the oblique and the transversus abdominis muscle. These contractions increase the intra-abdominal pressure, which forces the diaphragm superiorly, sharply depresses the rib cage and thus decreases the thoracic volume. The internal intercostal muscles, quadratus lumborum and the latissimus dorsi, also helps to depress the rib cage. Regarding the nerves of the thoracic wall, there are 12 pairs of thoracic spinal nerves. It leaves the spinal cord through the corresponding intervertebral foramina and divides into two branches: the posterior or the dorsal rami, which supplies the muscles, bones, joints and skin of the back, while the anterior or ventral rami innervates the intercostal musculature, periosteum of the ribs and the skin of the thorax. The ventral rami of T1 to T11 forms the intercostal nerve, while the ventral ramus of the T12 forms the subcostal nerve. Regarding the intercostal nerve, it enters the intercostal space between the pleura and the internal intercostal membrane. It runs in the middle of the intercostal space between the internal intercostal membrane and the muscle. Near the angle of the rib, it enters the intercostal groove between the internal intercostal and the innermost intercostal muscle. It gives branches to the muscle and the lateral cutaneous branch. Near the sternum, it turns anteriorly and ends as a superior cutaneous branch. It supplies the successive segments of the thoracoabdominal wall. T1 to T2 also supplies the upper limb. T3 to T6 only intercostal region, which are typical one, and the T7 to T11 intercostal region plus the abdominal wall. This figure represents the dermatome distribution in the thorax and the abdomen. Regarding the branches of the intercostal nerve, it provides muscular branches to the subcostal, transversus thoracis, levator costarum and the serratus posterior muscle. It also provides the collateral supply to the intercostal muscle. It provides cutaneous branches, the anterior and the lateral cutaneous branch, and a communicating branch which connects each nerve to the sympathetic trunk. Regarding the vasculature of the thoracic wall, the intercostal arteries and vein run in the costal groove. The posterior intercostal artery, the first one and the second one, arise from the superior intercostal artery, which is a branch of costocervical trunk of subclavian artery. The 3rd to 11th branch are the branches of the thoracic aorta. It accompanies the intercostal nerve. and provides branches. Posterior branch, it accompanies the dorsal ramus to supply the spinal cord, vertebra and muscles and the skin, while the collateral branch run along the superior border of the subjacent rib. While anterior intercostal arteries, 1st to 6th are the branches of the internal thoracic artery, while 7 to 9 are branches from the musculophrenic artery. 10th and 11th have no anterior intercostal, and it anastomoses with the posterior vessels in the intercostal spaces around the midclavicular line. This figure represents the relation of the neurovascular bundle in relation to the thoracic wall muscle. The neurovascular bundle passes between the internal intercostal and the innermost intercostal muscle. The intercostal vein, one posterior intercostal vein and two anterior intercostal veins are there. The posterior intercostal vein drains into the azygous and hemiazygous system. The superior vein drains into the brachiocephalic vein. On the right side, the first intercostal vein drains into the right brachiocephalic vein. The second, third and fourth join to form the superior intercostal vein, which drains into the azygous vein, and 5th to 11th and subcostal vein directly drains into the azygous vein. While on the left side, the first intercostal vein drains into the left brachiocephalic vein. The second, third and fourth join to form the superior intercostal vein, which drains into the left brachiocephalic vein. 5th to 8th drains into the accessory hemiazygous vein, and 9 to 11 and subcostal drains into the hemiazygous vein. This figure represents the venous drainage of the thoracic wall. The internal thoracic artery originates from the subclavian artery. It runs between the transverse thoracis and the sternum. It terminates by dividing around the xivisternal joint into the superior epigastric, which enters the rectus sheath inferiorly, and musculophrenic artery, which follows the attachment of the diaphragm to the ribs. It also sends branches to the thymus, bronchi and the pericardium. The branches of the internal thoracic artery are the pericardiophrenik, which accompanies the phrenic nerve. Mediastinal branches supplies the anterior pericardium, fat and the thymus. Perforating branches, anterior intercostal arteries, superior epigastric and musculophrenic are its terminating branches. The internal thoracic vein accompanies the artery as vena comitatus, unites in the upper 3 intercostal space and drain into the brachiocephalic vein. The intercostal artery, vein and nerve form a neurovascular bundle lying between the internal intercostal and the innermost intercostal muscle in the costal groove. The relationship of the neurovascular bundle is the above is vein, below is artery, and lowermost is the nerve. Regarding the thoracic cavity, it is a cone-shaped structure. It has a narrow superior aperture, which is called the thoracic inlet, and wide inferior aperture, which is called the thoracic outlet. Regarding the boundaries of the thoracic inlet, anteriorly it is bounded by the superior border of the manubrium, posteriorly by the upper part of the first thoracic vertebra, on the sides by the internal upper border of the first rib and the cartilage, and inferiorly by the diaphragm. And boundaries of the outlet includes anteriorly infrasternal angle between the costal margins, posteriorly inferior part of the T12 vertebra, laterally by the costal margin of 7th to 10th rib, and inferiorly it is completely closed by the thoracoabdominal diaphragm. Regarding the parts of the thoracic cavity is divided into 3 divisions, 2 pleural cavities and the other one is the mediastinum. The 2 pleural cavities occupy the lateral part and contains the lung, and the mediastinum is the space between the lung and the pleura. The mediastinum contains the pericardium and the heart and associated great vessels, while the trachea, esophagus, vagus nerve, phrenic nerve, thoracic duct, azygous vein, thymus and sympathetic trunk also are lying in the mediastinum. The pleural cavity is a double-layered serous membrane lined by the mesothelium. The parietal pleura or outer one is the adherent to the body wall, while the visceral pleura or inner layer is attached to the lung and its fissures. The 2 layers are continuous around the hilum. A potential space between the 2 layers is called the pleural cavity. The parietal pleura is attached to the costal, diaphragmatic, cervical and the mediastinal surfaces of thoracic wall by the endothoracic fascia. Parts of the parietal pleura are the diaphragmatic pleura, mediastinal pleura, costal pleura and the cervical pleura, which is also known as the copula. It also encloses the great vessel running in the lung root. Projects into the root of the neck as a copula. While the visceral pleura covers the surfaces and the fissures of the lung, it is firmly adherent to the lung. It is insensitive to pain. It provides moisture and lubricated surface for the lung movement. Adhesions with the parietal pleura may result from infections, inflammatory reaction, and the lung immobility. Visceral and the parietal pleura are continuous at the root of the lung, where the pulmonary artery, vein, and bronchus penetrate the lung. The continuity between the parietal and the visceral pleura surrounding the root of the lung extends downward as a fold, which is called the pulmonary ligament. It provides a space into which the pulmonary veins can expand. The pleural cavity is a slit-like potentious space between the parietal and the visceral pleura. It is filled with a thin layer of pleural fluid secreted by the pleura. It provides a lubricating fluid, allowing the lungs to glide over without friction or over the thoracic wall during the breathing movement. It holds the parietal and the visceral pleura together. Regarding the pleural recess, it is an area of the pleural cavity which is not occupied by the lung, reserved spaces for the lungs to expand. The two pleural recesses are there. First one is the costodiaphragmatic recess. It is lying inferiorly between the costal and the diaphragmatic pleura. It extends vertically for about 5 cm from 6th to 10th rib. The first part of the pleural cavity to be filled with effusion, while the costomediastinal recess is lying anteriorly between the costal and the mediastinal pleura. Innervation and blood supply of the pleura. The parietal pleura is supplied by the cervical, costal, and the peripheral diaphragmatic portion are supplied by the intercostal nerve and vessels, while the central portion of the diaphragmatic pleura and the mediastinal pleura are supplied by the phrenic nerve and the internal thoracic and musculophrenic vessels. It is sensitive to pain. It is venous drainage is into the intercostal vein, internal thoracic, and the azygous vein, while the lymphatics drain into the intercostal, internal mammary, diaphragmatic, and the posterior mediastinal lymph nodes. Visceral pleura is innervated by the sympathetic nerves derived from T4 to T5. It is insensitive to pain. Vasculature and lymphatics are similar to the lungs. Regarding the lungs occupy all of the thoracic cavity except the mediastinum. Each cone-shaped lung is suspended in its own pleural cavity and connected to the mediastinum. Regarding the external anatomy, it is spongy in texture and pink in color in young, but mottled black by carbon particles in the adults. It has following parts: an apex, base, 3 borders, which includes anterior, posterior, and the inferior border, and the 2 surfaces, costal and the medial surface. The apex is a blunt lying above the anterior end of the first rib. It projects into the root of the neck through the thoracic inlet, extending 1 inch above the medial 1/3 of clavicle. Anteriorly, it is grooved with the subclavian artery, covered by the cervical pleura and suprapleural membrane. The base or the diaphragmatic surface, it is semilunar and concave. It rests on the diaphragm, which separates the right lung from the right lobe of the liver and the left lung from the fundus of the stomach. It is found at the level of the 6th costal cartilage in the mid-clavicular line, the 8th costal cartilage in the mid-axillary line, and 10th rib dorsally. Due to the position of the liver, the base of the right lung is broader than the left lung. Regarding the borders, the inferior border separates the base from the costal and the medial surface. The anterior border is thin and short. On right side it is vertical, and on left side it shows a wide cardiac notch. While posterior border is thick and ill-defined, it corresponds to the medial margin of the head of the ribs and extends from 7th cervical spine to 10th thoracic spine. Regarding the surfaces, the medial surface has vertebral and the mediastinal parts. The vertebral part is posterior, occupying the thoracic gutters. The mediastinal part lies anterior to the vertebral column. It contains the hilum of the lung, while the costal surface is lying adjacent to the sternum, costal cartilages, and the ribs. Impressions on the mediastinal surface. Anterior to the hilum, it is cardiac impression on both the lungs, but more pronounced on left. Posterior to the hilum, esophagus and thoracic aorta on the right and left respectively, and superior to the hilum, azygous vein and arch of aorta on the right and left lung respectively. The root of the lung is a short, broad pedicle which connects the medial surface of the lung with the mediastinum. It is formed by the structures which leave or enter the lung at the hilum. It lies at the level of T5 to T7. The contents of the root of the lung are bronchus, which is lying posteriorly. On left side, it divides after entering, and it is only one number, while on right side, it divides before entering the lung hilum, and it is aparterial and hyparterial bronchus. Second one is the pulmonary artery. On the left side, it is more anterior and on higher side, while on the right side, it is between the aparterial and hyparterial bronchus. Third one is the pulmonary veins, two in each superior and inferior. The superior pulmonary vein is anterior and inferior to the pulmonary artery and bronchus, while the inferior pulmonary vein is the inferiormost. Bronchopulmonary lymph nodes, bronchial vessels, which includes the bronchial artery and bronchial vein. Bronchial artery are on left side it is two in number, which are the branches of the descending thoracic aorta, and on the right side it is one upper left, which is arising from the upper left bronchial artery or third posterior intercostal artery. Bronchial vein on the right side it drains into the azygos, and on the left side it drains into the accessory azygos and hemiazygos. The pulmonary plexus, which includes both sympathetic as well as parasympathetic fibers, lymphatics of the lung, and the areolar tissue. On the right side, the right lung has three lobes and two fissures. The horizontal fissure extends from the anterior border of the right lung at the fourth costal cartilage to meet the oblique fissure at the mid-axillary line. It divides the superior from the middle lobe. The other one is the oblique fissure, which lies between the middle and the inferior lobes. From posterior border 6 cm below the apex at the third thoracic spine to the inferior border 5 cm from the median plane. Examination of the superior lobe is done on the anterior chest wall, whereas examination of the inferior lobe is done posteriorly below the scapula. These are the mediastinal relations of the right lung. The pericardial impression is there anterior to the hilum, which is marked by the right atrium. IVC impression is posterior to the pericardial mark. SVC impression is anterior and superior to the hilum. Esophageal impression is large vertical groove behind the hilum and impression of the trachea. Trachea is lying behind the SVC. Azygos groove is behind the esophagus, and ascending aorta and thymus anterior to the hilum. Regarding the left lung, it has a superior and inferior lobe divided only by the oblique fissure. It has a large cardiac notch found on the mediastinal surface. The lingula is a segment of the anterior projection of a superior lobe below the cardiac notch, which overlies the anterior aspect of the heart. These are the mediastinal impressions on the left lung. First one is the pericardial, which is occupied by the left ventricle. Second one is the arch of the aorta, which is lying above the aortic pulmonary root. Third one is the thymus above the root anterior to the groove for the arch of aorta. Fourth one is the descending thoracic aorta, which the impression of which is lying posterior to the hilum, and the lastly is the left subclavian artery, which is superior to the groove for arch of aorta. These are the differences between the right and left lung. The right lung is larger and heavier, weighing around 700 grams in adult patient. Left lung is smaller and lighter, around 600 grams. The length and width of the right lung is shorter and broader, while that of left lung is longer and narrower. The anterior border of right lung is straight, while that of left lung is having cardiac notch and lingula. The lobes and fissures of the right lung, there are 3 lobes and 2 fissures in the right lung, and 2 lobes and 1 fissure in the left lung. Right lung is supplied by only 1 bronchial artery, while left lung is supplied by the 2 bronchial arteries. And arrangement in the hilum, the PA is higher on the right side, and there is 1 bronchus, while on the left side PA is between the bronchi and there is 2 bronchi. The conducting zone of the bronchial tree. First one is the primary bronchus. The right and the left primary bronchi are formed by the division of the trachea at the level of 4th thoracic vertebra in the mediastinum. The right bronchus is shorter, wider, and more vertical than the left. Inhaled particles tend to pass more frequently to the right lung, the posterior basal segment most likely. The lobar bronchi, each primary bronchus enters into the hilum of the lung and divides into the secondary or lobar bronchi. On the right side, there are 3 divisions of the major bronchus, upper, middle, and lower, while on the left side there is only 2 divisions, upper and lower. It again divides into tertiary or segmental bronchi, which supplies the bronchopulmonary segment of the lung. The tertiary bronchus is joined by the tertiary division of the pulmonary artery. This represents the division of the right and left main bronchus. On the tertiary or segmental bronchi, on the right side there are 10 in number, and on the left side 9 in number. The right superior lobar bronchi, it divides into the apical, posterior, and the anterior tertiary bronchi, while the left superior lobar bronchus divides into apico-posterior, anterior, superior lingular, inferior lingular segmental bronchi. The right middle lobar divides into the medial and lateral tertiary bronchi, while right and left inferior lobar divides into the superior, medial, basal, lateral basal, anterior basal, and posterior basal segmental bronchi. These are the bronchopulmonary segment. It is pyramidal section of the lung served with one tertiary bronchus. Base is toward visceral pleura and apex towards its hilum. The right lung has 10 bronchopulmonary segments and the left lung has 9. Each segment is surrounded by the connective tissue independent of the and they are independent respiratory units. Bronchopulmonary segments in the right and left lung. In the right lung, the upper lobe includes the apical, anterior, and the posterior bronchopulmonary segment. The middle lobe includes medial and lateral, and the lower lobe includes apical, anterior basal, posterior basal, and medial basal and lateral basal segment. While in the left lung, the upper lobe includes the apico-posterior, anterior, superior lingular, and inferior lingular segment, while the lower includes the apical, anterior basal, posterior basal, medial basal, and the lateral basal segment. Blood supply to the lungs and pulmonary artery. There are two in number, one for each lung. It is derived from the bifurcated pulmonary trunk. It carries poorly oxygenated blood to the lungs for oxygenation, gives off branch to the superior lobe before entering the hilum. The right pulmonary artery is crossed over by the azygous vein, whereas the left pulmonary artery is crossed over by the arch of aorta at the level of 5th thoracic vertebra. Within the lung, it divides into the lobar branches and then segmental branches which have a close relationship with the tertiary bronchi in the bronchopulmonary segments. The bronchial artery supplies blood to the root of the lungs, supporting tissue and the visceral pleura. Origin on right side is there is one bronchial artery. It is arising from the third right posterior intercostal or upper left bronchial or superior posterior intercostal, and on the left side there are two bronchial arteries which arises from the thoracic aorta. It lies posterior to the bronchus, gives branch to the esophagus. It supplies the bronchial tree to respiratory bronchioles, and distal branches anastomose with the branches of the pulmonary artery. Regarding the bronchial vein, it drains only the region supplied by the bronchial artery. The rest is drained by the pulmonary vein. It terminates on the right side into the azygous vein, and on the left side it drains into the accessory hemiazygous or left superior intercostal vein. Pulmonary veins are 4 in number, 2 for each lung. It carries well oxygenated blood. It begins from the pulmonary capillaries as a small vein, joins into larger vein and drain into the intersegmental vein in the septa, which join to form the pulmonary veins. Two lower veins from the inferior lobe of each lung, upper right vein from the superior and middle lobe of the right lung, and upper left vein from the superior lobe of the left lung. The pulmonary veins also drain oxygenated blood supplied to the lungs by the bronchial arteries. Lymphatic drainage of the lung. The bronchopulmonary lymph nodes are two sets of lymphatics. It drains into the bronchopulmonary lymph nodes at the hilum. The superficial from the superficial part of the lung, and the deep from drains the bronchial tree, vessels, and the lung tissue. The tracheobronchial lymph nodes are there are two groups of tracheobronchial lymph nodes, superior and inferior, located at the bifurcation of the trachea, and both the nodes drain the bronchomediastinal lymphatic duct. On the right side, it drains into the right lymphatic duct, and on the left side, it drains into the thoracic duct. Regarding the nerve supply of the lungs, the bronchopulmonary plexus supplies both parasympathetic and sympathetic nerves to the bronchial and vascular trees. The parasympathetic fibers are preganglionic vagal. It provides secretomotor fibers to the glands in the bronchial mucosa. It is motor to the bronchial smooth muscle, causing spasm. It also provides sensory and vasodilatory effect to the bronchial and pulmonary vessels. Sympathetic fibers are postganglionic fibers from T2 to T5. It is vasomotor to the arterial system, causing vasoconstriction. It also provides bronchodilation, and it is inhibitory to the bronchial glands. Regarding the mediastinum, is a median region between the two pleural sacs, from superior thoracic aperture to the diaphragm, and from the sternum to the thoracic vertebral bodies. It is divided into superior and inferior mediastinum by imaginary plane passing through the sternal angle of Lewis anteriorly to the lower border of the 4th thoracic vertebra posteriorly. The superior mediastinum is a superior thoracic aperture to imaginary plane between the sternal angle and the lower border of 4th rib, while the inferior mediastinum is starting from the imaginary plane from sternal angle of Lewis to lower border of 4th thoracic vertebra to the diaphragm. It is again divided into anterior, middle, and the posterior mediastinum. The anterior mediastinum is lying between the pericardial sac and the sternum. It contains the thymus, sternopericardial ligaments, parasternal lymph nodes, and the transversus thoracis muscle. The middle mediastinum is occupied by the pericardial sac, heart, root of the great vessel, and the posterior mediastinum is lying between the lower 8 thoracic vertebral bodies and the pericardial sac. Posterior portion of the diaphragm inferiorly. It contains the esophagus, thoracic aorta, and the thoracic duct. Regarding the superior mediastinum, the boundaries of the superior mediastinum are formed anteriorly by the manubrium of the sternum, posteriorly by the upper 4 thoracic vertebra, superiorly by the inlet of the thoracic cavity, and inferiorly by the imaginary line passing from the sternal angle of Lewis to the lower border of T4 vertebra. The contents from anterior to posterior are thymus, the great vessel. Great vessels include the arteries like arch of aorta, brachiocephalic trunk, left common carotid, and left subclavian. Veins include the left brachiocephalic, upper half of SVC, and left superior intercostal vein. Nerves include phrenic nerve, vagus nerve, cardiac plexus, left recurrent laryngeal nerve, and the hollow organs like trachea, esophagus, and thoracic duct, and the muscles. The thymus is the most anterior structure of the superior mediastinum. It is prominent in the children, steadily grows until puberty and reaches maximum size. After puberty, it involutes and replaced by the fat and fibrous tissue. From the lower part of the thyroid gland to the fourth, lies from the lower part of the thyroid gland to the fourth costal cartilage. It has two lobes. Arterial supply is via the inferior thyroid, internal thoracic, and the anterior intercostal artery, while the venous drainage is to the left brachiocephalic, internal thoracic, and the anterior intercostal artery. Lymphatics drains into the parasternal, brachiocephalic, and the tracheobronchial tree, and the nerves are sympathetic, which is vasomotor to the vasculature. Great blood vessels. The brachiocephalic vein or innominate vein is formed by the union of the internal jugular vein and the subclavian vein behind the sternoclavicular joint. The tributaries are both on right and left side the internal thoracic vein, inferior thyroid vein. On left side only there is only superior intercostal vein and the thoracic duct, and on the right side there is right lymphatic duct. The right brachiocephalic vein is short and vertical. It is located lateral to the brachiocephalic artery, and right vagus lies between them, while right phrenic nerve is on the posterolateral aspect of the vein. While the left brachiocephalic vein is 2 times longer than the right, it passes from the left to right, posterior to the upper part of the manubrium, crossing left phrenic, right common carotid, and the brachiocephalic anteriorly. Superior vena cava is formed by the union of the right and left brachiocephalic vein behind the right first costal cartilage near to the sternum, located in the right part of the superior mediastinum and middle mediastinum, lateral to the descending aorta, anterior to the root of the lung, and anterolateral to the trachea. It pierces the pericardium opposite the right second costal cartilage. It ends into the upper aspect of the right atrium at the level of third costal cartilage. The average length of SVC is 7 cm. Regarding the aorta, it has 3 parts: the ascending aorta, arch of aorta, and the descending aorta. The ascending aorta is 5 cm long. It is covered in the pericardium. It begins behind the left half of the sternum at the level of third costal cartilage. It directs forward to the right to become continuous with the arch of aorta and ends at the level of right second costal cartilage. It has 3 dilatation: anterior, right posterior, and the left posterior aortic sinuses. The right and left coronary artery arise from the anterior and left posterior aortic sinuses respectively. The arch of aorta is exclusively located in the superior mediastinum. It begins in the right second costal cartilage, directs upward, backward, and to the left. It ends in the lower border of the T4 vertebra to be continuous with the descending thoracic aorta. It curves above the root of the lung behind the left primary bronchus. The relations of the arch of aorta, anterior and to the left aspect, nerves like left phrenic, upper and inferior cervical cardiac branch of the left vagus, left superior intercostal vein, left pleura, and the left thymus. Posterior and right aspect is lying trachea, esophagus, left recurrent laryngeal nerve, and the thoracic duct. On the superior aspect, brachiocephalic trunk, left common carotid, left subclavian, and thyroidea ima. And on the inferior aspect, bifurcation of the pulmonary trunk into the pulmonary arteries, ligamentum arteriosum, remnant of the ductus arteriosus, left recurrent laryngeal nerve, posterior to the ligamentum arteriosum, and the left principal bronchus. These are the relations of the aortic arch. Branches of the aortic arch includes the brachiocephalic trunk, left common carotid, left subclavian, and the thyroidea ima artery, which is variable in origin. Regarding the trachea, it begins below the larynx at level of cricoid cartilage at the level of sixth cervical vertebra. It is about 10 centimeters long and 2.5 centimeter wide, partly lying in the neck and partly in the superior mediastinum. It bifurcates at the level of T4 or T5 thoracic vertebra. It lies in the median plane and inferiorly it is displaced to the right by the aortic arch. Relationship of the trachea in thorax in the superior mediastinum. Anteriorly, it is related to the brachiocephalic artery and left common carotid artery. Posteriorly, it is related to the esophagus and recurrent laryngeal nerve. On the left, it is related to the arch of aorta, left common carotid and left subclavian arteries, and left recurrent and laryngeal nerve and pleura. And on the right side, right vagus, azygous vein and the pleura. Neurovasculature, blood supply is from the branches of the inferior thyroid artery and bronchial artery. Venous drainage is into the left brachiocephalic through the inferior thyroid vein, and lymphatics drain into the pretracheal and paratracheal lymph nodes. Nerve supply includes parasympathetic via vagus through the recurrent laryngeal nerve. It provides secretomotor fibers to the glands, and the sympathetic supply is from T1 to T4 segments of the vertebral column. It provides smooth muscle dilator and the blood vessel gives branches to the smooth muscles and the blood vessels. Regarding the phrenic nerve, branches of the cervical plexus root includes the ventral rami of the C3, C4 and C5 vertebra. It is a mixed nerve. It provides motor fibers to the diaphragm, sensory fiber to the fibrous and parietal layer of the serous pericardium, mediastinal and the diaphragmatic pleura, diaphragmatic peritoneum and the abdominal viscera. Right phrenic nerve enters the thoracic cavity behind the right subclavian and descends close to the right brachiocephalic vein and right to the SVC. It leaves the thoracic cavity through the caval opening of the diaphragm with IVC. It is accompanied by the right pericardiophrenic vessels, while the left phrenic is anterior to the left subclavian and crosses the arch of aorta anteriorly. This figure represents the course of the phrenic nerve as well as its branches. The vagus nerve is the 10th cranial nerve originating from the medulla oblongata. Each of them passes behind the root of the lung, giving large contribution to the pulmonary plexus. Below the hilum of the lung joins the esophageal plexus, become mixed after leaving the plexus. Right and left vagal trunk contains fiber from each vagus. On the arch of aorta, the left nerve gives off the left recurrent laryngeal nerve that hook around the ligamentum arteriosum, passing upwards on the right side of the arch of aorta, ascending between the esophagus and the trachea. The right recurrent laryngeal nerve is given off in the root of the neck and hooks around the right subclavian artery. This figure represents the course of the right and the left vagus nerve in the mediastinum. Branches of the vagus in the thorax includes the cardiac branches to the superficial and the deep cardiac plexuses, left recurrent laryngeal nerve, anterior pulmonary branch and posterior pulmonary branch, and esophageal branches to the esophageal plexus. In anterior mediastinum, it lies between the pericardium and the sternum, become continuous with the superior mediastinum through the pretracheal space. It contains thymus, sternopericardial ligaments, parasternal lymph nodes, and the transversus thoracis muscle. In the middle mediastinum, it is bounded superiorly by the imaginary line passing from the sternal angle of Lewis to the inferior border of the fourth thoracic vertebra, inferiorly by the diaphragm where the pericardium rests. On the right and left lateral side corresponding mediastinal pleura, anteriorly by the anterior mediastinum and part of the pleura, and posteriorly by the posterior mediastinum. It contains the heart and the pericardium and the great vessels like SVC, IVC, pulmonary trunk and veins, and part of aorta, part of phrenic nerve. The posterior mediastinum is a space behind the pericardium and the diaphragm. The boundaries are posteriorly, it is bounded by the thoracic vertebra T5 to T12, and anteriorly above by the pericardium, bifurcation of the trachea and pulmonary vessels, inferiorly by the posterior part of the diaphragm, and laterally by the mediastinal pleura. The contents of the posterior diaphragm includes the esophagus, descending thoracic aorta and its branches, thoracic duct, right lymphatic duct, azygous system of vein, thoracic sympathetic trunk and splanchnic nerves, vagus nerve and the lymph node. The descending thoracic aorta course It begins on the left side of the lower border of the body of fourth thoracic vertebra. It descends with inclination to the right. It terminates at the lower border of the T12 thoracic vertebra where it passes through the aortic hiatus. Relations of the descending thoracic aorta anteriorly to the root of the left lung, pericardium and heart, esophagus and the diaphragm, posteriorly to the vertebral column and hemiazygous vein. To the right side, esophagus, azygous vein, thoracic duct and right lung and the pleura. To the left side, to the left lung and pleura, the greater splanchnic nerve from the sympathetic trunk joins the descending aorta and enters the abdomen with it. These are the branches of the descending thoracic aorta, which includes two left bronchial arteries, esophageal arteries supplying the middle one-third of the esophagus, pericardial branches, mediastinal branches, right and left posterior intercostal arteries for 3rd to 11th intercostal spaces, right and left subcostal and right and left superior phrenic. The azygous and the hemiazygous system. The azygous vein drains the posterior thoracic wall and the upper lumbar region. It connects the superior and the inferior vena cava. It forms by originating in the abdomen by union of the lumbar azygous, right ascending lumbar and the right subcostal vein. It enters into the thoracic cavity through the aortic opening or pierces the right crus of the diaphragm. It ascends on the right side of the vertebral column and arches over the right bronchus to enter the posterior aspect of the superior vena cava at the level of 4th thoracic vertebra. The tributaries are the right superior intercostal vein, right 5th to 11th intercostal vein, the right subcostal vein and right ascending lumbar vein, right bronchial vein, esophageal, mediastinal and pericardial veins, hemiazygous vein and accessory hemiazygous vein. The hemiazygous vein originates in the abdomen by the union of left ascending lumbar and left subcostal or from the left renal vein. It enters into the thoracic cavity by piercing the left crus of diaphragm at T9, crosses to the right behind the thoracic aorta, esophagus and thoracic duct and ends in the azygous vein. The tributaries are 9 to 11th intercostal vein, left subcostal and left ascending lumbar vein. While the accessory hemiazygous vein originates at the medial end of 4th or 5th intercostal space on the left side of the vertebral column, it crosses to the right at 8th thoracic vertebra behind the aorta, esophagus and joins the azygous vein. Tributaries are left 5th to 8th intercostal vein and left bronchial vein. The esophagus is a muscular tube. It provides passage for the food between the pharynx and the stomach. It extends from the level of 6th thoracic vertebra to the stomach below the left dome of diaphragm. Its length is about 25 cm. It has three parts: cervical, thoracic and the abdominal. It pierces the diaphragm at the level of 7th costal cartilage or T10 level. There are four constrictions in the esophagus. First at the C6 level at the beginning. Second is at T2 or T3 level where it is crossed by the aortic arch. The third one is at T4 or T5 where it is crossed by the left primary bronchus, and fourth one is at T10 level where it pierces the diaphragm. Obstruction may occur at this level. These levels are respectively 15, 22, 27 and 40 cm from the incisor teeth. The relations of the trachea: anteriorly it is related to the relations of the esophagus. Anteriorly it is related to the trachea, right pulmonary artery, left bronchus, base of the heart and the diaphragm. Posteriorly to the vertebral column, thoracic duct, right posterior intercostal artery, azygous and the hemiazygous system, thoracic aorta and the diaphragm. To the right, right lung and pleura, azygous vein and the right vagus. To the left, aortic arch, left subclavian artery, thoracic duct, left lung and pleura, left recurrent laryngeal nerve and the thoracic aorta. Arterial supply in cervical part up to the arch of aorta, it is supplied by the inferior thyroid artery. In the thoracic part, it is supplied by the esophageal branches of the thoracic aorta, and in the abdominal part, it is supplied by the esophageal branches of the left gastric artery. The venous drainage from the upper part is draining into the brachiocephalic vein, from the middle part into the azygous vein, and from the lower end into the left gastric vein. The lower end of the esophagus is one of the sites of anastomosis between the systemic and the portal vein. In the portal hypertension, dilatation of the lower esophageal vein called esophageal varices, which ruptures and then result in hematemesis. Regarding the nerve supply, the parasympathetic supply is derived from the upper half by the recurrent laryngeal nerve, in lower half by the esophageal plexus, which is formed by the two vagus. Functions are sensory, motor to the muscle, and mucus secreting glands. Sympathetic supply is in upper half by the middle cervical ganglion and in lower half by the upper four thoracic ganglia derived from the esophageal plexus. It functions vasomotor. Lymphatic drainage in the cervical esophagus drains into the deep cervical lymph node. Thoracic segment drains into the posterior mediastinal lymph node, and the abdominal segment drains into the left gastric lymph nodes. Regarding the diaphragm, it is a dome-shaped musculotendinous partition between the thoracic and the abdominal cavities, the principal muscle of respiration. It is composed of the two portions, muscular, which is peripheral part, and the aponeurotic, which is central part. The muscular fibers converge radially to the central tendon. Three parts based on the origin. First one is the sternal, which is arising from the back of the Gifford process. Second one is the costal, which arises from the inner surface of the lower six costal cartilages. And lastly is the vertebral, which is arising from the lumbar vertebra by two crura. On the right side, the central tendon is aponeurotic tendon formed by the fibers of different direction. It has three lobes, right, left and median. The relation of the lobes on the left side related to the left pleura, on the right side to the right pleura, and median to the pericardium. Major openings present in the diaphragm are, first one is the aortic hiatus, which is located at T12 level in the median plane. It transmits the descending thoracic aorta, thoracic duct, and the azygous vein. The other one is the esophageal opening, which is located at T10 level to the left of the median plane, transmits the esophagus vagi, anterior and posterior, and esophageal branch of the left gastric artery. And lastly is the vena cava opening, which is lying at T8 level to the right of the median plane within the central tendon. It transmits the IVC branch of the right phrenic and lymph vessels from the liver. The other structures passing through the diaphragm are the superior epigastric vessel between the sternal and the costal origins. Musculophrenic nerve, it pierces at 7 or 8 costal cartilage. Lower 5 intercostal nerves between the two slips of the costal origin. The subcostal nerves and vessels behind the lateral arcuate ligament. The quadratus lumborum behind the lateral arcuate ligament. The sympathetic trunk behind the medial arcuate ligament, the psoas major behind the medial arcuate ligament, splanchnic nerve pierces the corresponding crus of the diaphragm, and the hemiazygous vein pierces the left crux of diaphragm. The nerve supply is mainly provided by the phrenic nerve, which is motor and sensory, and lower 6 intercostal and subcostal nerve for the peripheral part. The blood supply is from the superior surface is supplied by the superior phrenic artery arising from the thoracic aorta, and musculophrenic and pericardiophrenich artery arising from the internal thoracic artery. The inferior surface is supplied by the inferior phrenic artery. The venous drainage is same as the arterial supply, and the lymphatic drainage of the diaphragm is into the thoracic surface to the phrenic nodes, abdominal surface to the lateral aortic nodes, and the two surfaces communicate freely. With this, we end the presentation on the thoracic anatomy. Thank you.